Hi, this is Dr. Stephen Bracci for Medical Cosmetics. What are cosmetic injectables? What are your choices and how do they work? Well, Botox is the main cosmetic injectable in the Botox type of medications, and then there's the fillers. There's two basic types. There's the soft hyaluronic acid fillers and the firmer fillers such as Radius and Sculptra. Starting with Botox, how does Botox work? Well, Botox is a neuromodulator or neurotoxin, and other brand names you may know of are Jeuveau, Dysport, Daxxify, Xeomin. Basically, they all work basically on the same principle, and they relax the muscles that cause wrinkling of the skin. So they're great for areas such as this glabella or the between the eyes, crow's feet, corners of the eyes, forehead. I like them for the neck bands. And also they're great for underarm for sweating. And then the reason why they work for sweating is because there's muscles that surround the sweat glands. Relaxing those muscles relax the sweating and the perspiration. So basically, these Botox-related products relax muscle tension, reduce wrinkling of the skin, and reduce the muscular response of sweating. The next group of injectables is the soft hyaluronic acid type of fillers, and they're the most utilized type of fillers. Those are brand names such as Juvederm, Restylane, Volatero, Versa, and they're used for various cosmetic purposes. However, I try to use these soft hyaluronic acid fillers in very small amounts because they work by holding water in the area and they make you puffy. I love them for certain areas like the lips, lip lines, nose, but I choose not to use them so much for mid-face or nasolabial folds so much because of that water retention property and the issue and the concern of making people look puffy. The next filler type is the first of the firm fillers, and that's Sculptra. Basically, Sculptra is a seed. You inject Sculptra in with some liquid, it stimulates your own collagen production, it makes the size of the area bigger, and it's great for just giving you overall volume, especially for people who have big volume needs in their face. For people, it's great for the buttocks area because it gives filling, and over time it just builds this collagen. It doesn't, however, give you great definition because it's just a bulk filler. The next filler of the firm fillers is called Radius, and that's a filler I personally use a lot of because that filler is made from calcium. It's calcium hydroxylapatite. It's similar to the calcium that's in our bone and our teeth, and it gives a really great lifting. It's great for contouring and great for shaping the face, and also stimulates collagen and elastin, and it supports new blood vessel development called angiogenesis. So it's a great overall filler in the right hands. It's not utilized a lot in the industry because it's more technically demanding to use, but in the right hands, this is where you can get great contouring, lifting, and support to the face. So cosmetic injectables, first is the fillers. Basically, they're injected to areas of concern. They fill in lines, they fill in wrinkles. And as I mentioned, they do much more than just filling. They can produce that lifting, they can produce that contouring and that support, so they can overall give you really great definition and not just size to the face. The longevity of fillers varies on the type of filler that's been used, how much is being used, and the areas of the face that's being used in. So there's a lot of variability, anywhere from a few months they last to a few years. The key to fillers, however, is to get customized treatment, even with Botox. And the treatment should be tailored to the needs of your facial aesthetics. So when you're buying these things, you're not just buying an ingredient. It's really the skills and the expertise of the provider to make sure it makes your face natural looking overall. It matches the contours and the architecture of your face in general. So the key is to get a consultation with a provider that knows all of the different fillers, knows all the different areas that can be treated with Botox and the neuromodulators to meet your aesthetic goals.